University Sains Malaysia, menara ilmu tercinta, jadi tumpuan antara bangsa untuk segala cita-cita. Berinovasi, berteknologi, berwawasan, berkualiti. Biar usaha kami bersemi, hasratnya lah berseri. University Sains Malaysia, menara ilmu tercinta, jadi tumpuan antara bangsa untuk segala cita-cita.
Assalamualaikum warahmatullahi wabarakatuh, and salam sejahtera to Madam Jamilah Kadir, Director of SEAMEO Regional Centre for Special Education Needs, SEAMEO SEN, Professor Dr. Wan Rosli Wan Ishak, Dean of School of Health Science, University Science Malaysia, Professor Dr. Muhammad Normani Zakaria, Chairman of Audiology Program, School of Health Science, University Science Malaysia. Dr. Muhammad Fazil Nur Rashid, Director of World Hearing Day 2025 webinar. Esteemed speakers for the day, World Hearing Day 2025 webinar committee, health specialists, practitioners and professionals, education professionals and practitioners, ladies and gentlemen from all over Malaysia and potentially the Southeast Asian region and beyond. On behalf of the organizer, SEAMEO Regional Centre for Special Education Needs, SEAMEO SEN, Audiology Program of School of Health Science, University Science Malaysia, and Audiology Clinic, USM Specialist Hospital, I would like to welcome everyone to our World Hearing Day webinar, Empowering Hearing Healthcare in Special Education, the Malaysian Perspective. As some of you might be tuning in to us from various time zones, allow me to say good morning, good afternoon, and good evening. We would also like to express our highest gratitude to our platinum partner as well as our gold partner for sponsoring our webinar for today. World Hearing Day is observed annually on 3rd March to raise awareness about deafness and hearing loss prevention and to promote ear and hearing care worldwide. This year, Audiology Program of School of Health Science, USM, and Audiology Clinic, USM Specialist Clinic, have collaborated with SEAMEO SEN to organize this webinar with an aim to increase understanding of the critical nature of hearing and proper hearing management for school-age children, as well as proper hearing management as well as to promote awareness of the significance of inclusive education for school-age children who are deaf and hard of hearing. The webinar is expected to run for 3 hours, and we hope you will stay tuned with us until the end of the event. Allow me to introduce myself. My name is Fitri, and I will be your MC for the day. Ladies and gentlemen, let us open today's event by listening to the welcoming remark by Madam Jamilah binti Kadir, Director of SEAMEO SEN. Please welcome Madam Jamilah binti Kadir.
Assalamualaikum and a very good morning to all the distinguished guests, esteemed speakers, dedicated educators and participants. A very warm welcome to everyone attending this webinar on Empowering Hearing Healthcare in Special Education, the Malaysian Perspective. It is truly an honor to have such a diverse group of professionals, educators and advocates coming together to discuss an issue that holds great significance in the field of special education, ensuring quality hearing healthcare for children with hearing impairments. At SEAMEO SEN, we firmly believe that inclusive education begins with accessibility. Hearing loss affects millions of children worldwide, including here in Malaysia, and without early detection and proper intervention, it can significantly impact a child's language development, academic progress, and also social inclusion. And by fostering greater awareness and equipping educators with the right knowledge and right strategies, we can help bridge the gap and ensure that children who are deaf or hard of hearing receive the support they need to thrive in their learning environments. This webinar serves as a collaborative platform where we will discuss the importance of hearing healthcare, early intervention, and inclusive education practices for school-aged children. We are privileged to have experts in audiology and special needs education share their insights and best practices, and which allows us to explore solutions that benefit both educators and students. Additionally, this initiative strengthens the partnership between University Science Malaysia and SEAMEO SEN, paving the way for future collaboration in hearing, healthcare, and education. Throughout this session, I encourage all of you to actively engage, ask questions, and also exchange knowledge. These discussions today will not only enhance our understanding of hearing healthcare, but it also inspires meaningful action in our schools and also communities. By working together, we can create inclusive learning spaces where every child, regardless of their hearing ability, has the opportunity to succeed. On behalf of SEAMEO SEN, I extend my sincere appreciation to University Science Malaysia and all the speakers, organizers and participants for making this event possible. And may today's discussion lead to impactful changes in special education and also empower us all to advocate for better hearing healthcare in our schools. Thank you, and I wish you all a fruitful and insightful session ahead.
Thank you, Madam Jamila, for the welcoming speech. Now, please welcome Professor Dr. Wan Rosli Wan Ishak, Dean of School of Health Science, University Science Malaysia, to deliver his speech and officiating our webinar for today. Professor Dr. Wan Rosli Wan Ishak, the floor is yours.
Madam Jamila Kadir, Director, SEAMEO Regional Centre for Special Education Needs, SEAMEO SEN, Professor Dr. Muhammad Normani Zakaria, Chairperson of Audiology Program and Unit Coordinator Audiology and Speech Pathology Unit, University Science Malaysia, Dr. Muhammad Fadil Nur Rashid, Director of World Hearing Day 2025, Committee Members of World Hearing Day 2025, ladies and gentlemen, Assalamualaikum warahmatullahi ta'ala wabarakatuh and very warm greetings. Alhamdulillah, I'm most grateful to Allah subhanahu wa ta'ala, the most gracious and merciful, for blessing us with the opportunity to gather here to celebrate World Hearing Day 2025. World Hearing Day, WHD, is celebrated annually on 3rd March, and the theme for this year is Changing Mindsets, Empower Yourself to Make Ear and Hearing Care a Reality for All. This campaign will focus on changing mindsets towards ear and hearing care in individuals of all ages to empower themselves to ensure healthy ears and hearing for themselves and others. According to WHO, by encouraging individuals to recognize the importance of ear and hearing health, this campaign aims to inspire them to change behavior to protect their hearing from loud sounds and prevent hearing loss, checking their hearing regularly, use hearing devices if needed, and support those living with hearing loss. Empowered individuals can drive change within themselves and in society at large. I would like to express my utmost gratitude and appreciation to all committee members in ensuring the success of this event. It is a great pleasure to welcome all guests. My hope is that this collaboration will strengthen and deepen our working relationship in promoting better healthcare services for community. Ladies and gentlemen, allow me to share one interesting fact. By 2030, over 500 million people are expected to have disabling hearing loss requiring rehabilitation. According to WHO, over 1 billion of young people face the risk of permanent hearing loss due to prolonged exposure to loud sounds during recreational pastimes such as listening to music and video game play. How we hear in the future depends on how we care for our ears today, as many cases of hearing loss can be avoided through the adoption of safe listening and good hearing care practices. For those living with hearing loss, early identification and access to timely rehabilitations are essential to achieving in highest potential. You can take steps today to ensure good hearing with health throughout life. Along with this, we at the national level, including University Science Malaysia, have been actively promoting the spirit of World Hearing Day. According to the previous Malaysia Health Minister statement during World Hearing Day 2022, he stated that 40,743 registered hearing impaired adults and children in Malaysia as December 31st, 2021. These figures, however, were underreported. He urged hearing impaired individuals to register under the Disabled People's Scheme to qualify for the benefits they are entitled to. In addition, in the latest report by the Department of Statistics Malaysia in 2023, about 6.3% of the person with disability had been registered under hearing disability. Ladies and gentlemen, to show our further interest this year, we are collaborating with SEAMEO SEN to conduct a webinar on ear and hearing care, especially among school children. Consider the importance of raising awareness in community, especially related to education to children. University Science Malaysia places a great attention in expanding hearing healthcare. University Science Malaysia, as one of the leading institutions in Malaysia, has established the audiology program under the School of Health Sciences in the year of 2005 and began producing qualified audiologists since year 2009. All audiology graduates have received their intensive clinical training not only at the School of Health Sciences but also from experienced audiologists from the Unit Audiology and Pathology, Speech Pathology Hospital Pakar University Science Malaysia. To further demonstrate our dedication, we have conducted several hearing screening not only for school-age children but for the elderly population. For example, in December 2024, audiology program had organized hearing screening at the Pusat Aktiviti Warga Emas Gua Musang, Kelantan, Malaysia, and we found out that 45% of the participants had hearing impairment and need further hearing diagnostic hearing assessment. Ladies and gentlemen, before I conclude, I would like to congratulate all community members for organizing this event. This collaboration effort should be continued in future. To all participants, we appreciate your time commitment to this event. I believe this event will benefit academia, industry, and most importantly, the community. I wish you all the best and a successful event. With Bismillahirrahmanirrahim, I hereby officiate this event. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you.
Thank you, Professor Dr. Wan Rosi, Wan Ishak, for officiating our webinar for today. Before we go any further, allow me to share some notes as a reminder for all of our participants. We hope all participants and presenters will tune in from the start until the end of the webinar to avoid missing out on important sharing and announcement. Kindly refrain from using the comment sections for conversation with other listeners. Instead, you may address questions to the speakers. We will do our best to address all the questions during the forum session held after all of the keynote speech completed. If you are facing with sounds or video issues, you can head either to our Facebook or YouTube account to keep tuning in. E-certificate shall be issued only to registered participants. For those who have yet to register, you may still register at our SEAMEO SEN Integrated Excellence System (SIS) site by heading to sis.seameosen.edu.my. E-certificate will be available upon completion of the evaluation on the SIS site. Evaluation link will be activated at the end of the webinar. Rest assured, we will remind you again at the end. Please complete both registration and evaluation within today after the announcement or before 12 midnight Malaysian time. If you need further assistance, you may reach us through our email training@seameosen.edu.my. Ladies and gentlemen, we will now proceed to our keynote speech session. To officially start the session, I would like to invite our first keynote speaker, Madam Cheu Lih, University Lecturer for Audiology Program, School of Health Science, University Science Malaysia, to share with us on the topic of supporting every child hearing, the role of audiologists in educational settings. A little bit about herself. Madam Au has been actively engaged in clinical practice, teaching, and research, with a strong focus on supporting children with hearing needs. She holds a Master in Clinical Audiology from University of Melbourne, Australia, and prior to joining academia, she gained valuable clinical experience at KK Women's and Children's Hospital in Singapore, as well as USM. Her expertise covers pediatrics and adult hearing assessment, particularly on oral rehabilitation and cochlear implants. With over 15 years of experience in clinical supervision, Madam Au is committed to ensuring that children with hearing difficulties receive the necessary support in both clinical and educational settings. Her recent academic work also explored inclusive education for children who are deaf and hard of hearing, DHH, in Malaysia, integrating perspective from both audiology and education. Additionally, she is actively involved in DPRINCE, an early education center for DHS children at USM, further reinforcing her dedication to accessible education for all. Now, without further ado, please welcome Madam Cheu Lih.
A very good morning to all of you. Welcome to today's first topic of webinar, Supporting Every Child's Hearing, the Role of Audiologists in Educational Setting. So for today's topic, I'm going to talk about the common hearing challenges in children with deafness or hard hearing at school, the role of audiologists, the importance of early hearing assessment and intervention, and how can teachers support students with DHS at school. First of all, who are audiologists? Audiologists are healthcare professionals specializing in hearing and balance disorders. We work with all individuals of all ages, including children in school. Audiologists also diagnose and manage hearing loss, fit hearing aids, and assistive listening devices. So let's start with some introduction about. As we all know, hearing is very important for learning, communication, and social interaction, regardless of what school the child is in. So students rely heavily on hearing to develop language, literacy, and academic skills. Research also consistently shows that even a very mild form of hearing loss can negatively affect the child's academic performance. So that's why it's important to know the signs of hearing difficulties when they are studying in a classroom. First sign is they frequently ask for repetition as if they don't understand. Second, you find them difficult to follow verbal instruction, and they seem like inattentive to the class teaching, and sometimes they misinterpret the words or misunderstood what has been told to them. Some children, they will speak loudly, and some will speak very softly, depends on the type of hearing loss that they have. Some also will complain having listening to noises in their ears, we call ringing, or having ear pain. If a child shows that the signs of hearing difficulties, they might also have difficulties understanding teachers and peers, and it's depending on the situation. As shown in the pictures, there are in this classroom, it can be in a lecture style, in a group style, and outside the classroom. So in the lecture style, the speech of the teachers is right in front, and depending on where the child sits, if the child is sitting further away from the teachers, of course the teacher's voice level will be softer compared to those who are sitting in front. In a group situation, the most challenges is the noise that coming from all the students talking at the same time. So the noise is competing with the speech level of the teachers that the child wants to listen. So they might find it difficult to follow the group discussion, the class activities. And okay, other than that is the background noise and the classroom acoustic. If it is poor, then they might have to face the echo from the noise echo from the room as well. So the most reported challenges is in the literacy and the language subjects. Other than that, they may have limited access to incidental learning that needs overhearing due to their hearing difficulties. So overhearing is not happening like frequently. That's why it's limited access to the incidental learning. So one of the most challenging aspect will be the communication barriers, depending on what kind of education setting the child is in, and also their capabilities to use the verbal speech or using signing. If the mode of communication that they use is different from the education settings that they are in, that will cause communication barriers, and then it will eventually cause social isolation. And all the child with the hearing difficulties, including those who wear hearing aids, they pay a lot of attention to listen. So the listening effort that they have from the morning until the afternoon is a lot. That's why towards the end of the day or in the afternoon, they'll be fatigued from the listening effort that they have to give. The last one is the dependence on technology, because for those who wear hearing devices, they're very depending on the technology, because almost of it will be electronic device that needs battery. When it's running out of battery, that means their hearing has to shut down for a while. So knowing that all the hearing challenges, the signs, let's look at how our ear listen. We go back to the basics. Understanding how our ears works will help us understand what kind of intervention or helps that the students need. So our ears divided into three parts: the outer ear up to the eardrum, the middle ears with the ossicles, and the inner ear with the cochlea and the auditory nerve to the brain. Okay, the sounds will go from the outer ear to the external auditory canal, to the eardrum, the ossicles, and then go into the inner ear, the cochlea. Knowing the ear structures is important because we now understand how the sound travels from the outer ear to the brain. So any disruption can cause hearing loss. Well, in children, there are two types of the hearing loss that we can see from here. Is congenital hearing loss, which presents at birth. Acquired hearing loss appears after birth at any time in one's life. Can be due to disease, injury. So congenital hearing loss also causes prelingual deafness, which means the child has a hearing loss before they acquire language. Acquired hearing loss usually is called postlingual, depending on the time of onset of the hearing loss. Okay, to be more specific, based on the ear structures, we have three types of the hearing loss. First, conductive hearing loss, where the Origin of the problem is from the outer or middle ear. So that means any disruptions at these two parts of the ears, it can cause conductive hearing loss. For example, impacted earwax, otitis media, commonly in children is ear infections. Second, sensory neural. This hearing loss, the origin of the problem will be from the inner ears onwards. Some children might have mixed hearing loss where some of the conductive hearing loss and the sensory neural hearing loss. So most of the conductive hearing loss case can be treated medically or surgically, while sensory hearing loss may not be treated that way. They might need to wear hearing aids or cochlear implants. Okay. After knowing the ear structures and how the ears works, how the hearing works, let's look at the roles of audiologists. The roles of audiologists in school is to support students with hearing loss and other hearing-related challenges. So first of all, hearing assessment and early identification, staff and student education about hearing, collaboration with parents, teachers, speech-language pathologists, and special education teams. Audiologists also advocate accessibility, for example, proper classroom acoustic and assistive listening devices. So let's look at the importance of having early hearing assessment and identification. So why is it important? Because once we have the hearing assessment, we can identify and support students with hearing challenges. So we can also provide them with interventions to improve their access to learning in the classroom. So without the assessment, we don't know which students will have the hearing challenges. So therefore, the intervention will not be taken place. So it has to be as early as possible. So next is to understand how the hearing is tested. So you can see from the picture, a school-age child, usually they can sit down and they can wear headphones and listening to some sounds and press the button. So we are going to vary the sounds from different frequency and different loudness. It sounds like a tone, a beep. So they need to press the button wherever they hear the sound. Okay, and then we're going to check right ear and left ear. So on the right side is what we call audiogram. The results we plot on the audiogram, where you can see different frequencies we plot at different places, and that means the level that the child can hear, the softer level the child can hear. So we call it hearing thresholds. Once this is established, we can know that what sound the child can hear and what cannot be heard. So this is an example of normal hearing. Okay, any thresholds that is worse than 20, that means the child has hearing loss, different degree of hearing loss. So next I can show you the example of hearing loss. The audiogram will looks different. This is called family sound audiogram. This is the same audiogram as I showed you in the previous slide, but now you can see a different pictures in the audiogram. It shows here the loud sound at the end is the aeroplane sounds. Okay, and the birds chirping lies here at the high frequency soft sound, and you see the speech banana, the shaded area is like a banana, the shaded sound. Comprised of the speech sounds, the consonants, the vowels. Okay, so if we have a normal hearing of 20 or 10 or 0, which means any sounds that is louder than 20 can be heard well. But then, if the hearing threshold falls at the mild category, as shown, they have no problem in a quiet in understanding the speech, because most of the speech sound can be still heard, but they might have problem in the noisy environment. Just imagine in a classroom. So getting to the next one will be the moderate loss. In the moderate loss, the speech sounds cannot be heard. Okay, they might have problem understanding speech. Maybe just if the teachers speak louder, then yes, some information still can be heard, but not all, especially in a noisy environment. So next will be in the severe case, can hear loud speech in quiet and great difficulty in noisy environment. So the last one will be profound loss. For children with profound loss, they're unable to hear and understand even a shouted voice in quiet and noisy environment. This is based on the best ear. Okay. So now you can see different degree of hearing loss can give rise to different hearing difficulties. So which means those with hearing loss doesn't mean they cannot hear speech at all. Depends on their degree of hearing loss. Okay. So therefore, it's very important to have early hearing screening to identify those who have hearing difficulties at school. Regular assessments ensure timely detection and intervention. Any delay in the diagnosis can cause delays in speech and language development, especially in the preschool age, struggles with reading, communication, and academic performance. It also increases the risk of social isolation and behavioral challenges. Okay, knowing the hearing problem, next let's go into the intervention. So what are the hearing technology in the classroom that can be used by the students? First of all, hearing aids. This is a more common types. Cochlear implants for those with a severe profound loss. FM system for any degree of hearing loss. Okay, let's go one by one. Hearing aid. Hearing aid amplifies sounds to help students to hear speech more. So the function of hearing is to amplify sounds so that when you reach the child's ears, it's a louder sound. It improves speech perception and understanding, enhance classroom engagement and participation. However, hearing aids do not restore normal hearing. So sometimes background noise can be still a challenge to hear speech. And while they are wearing this, they require regular maintenance. For example, battery change and cleaning. Also, they need to use it constantly to maximize the language benefits. Okay, unlike just wearing the glasses. Next, about cochlear implant. Cochlear implant is different from hearing aids. It's a medical device designed to provide a sense of sound to individuals with severe to profound hearing loss who do not benefit from hearing aids. It requires surgery to insert the electrodes into the cochlea as shown in the picture, and it directly stimulates the auditory nerve to send the sound signals to the brain. That means it bypasses the function of the cochlea. Cochlear implant also enable access to speech sounds when hearings are not sufficient, especially bilateral severe to profound hearing losses. So if you can recall, for congenital hearing loss, that means prelingual deafness, if they are born with bilateral severe profound hearing loss, cochlear implant might be the most suitable device for them. And you should know by now, it's severe profound hearing loss. Without any devices, they have no access to the speech sound. They cannot hear speech sound without any hearing devices. Therefore, with the cochlear implant, it can support spoken language development, because if they can hear well since very young, and with rehabilitation, with the constant rehabilitation, it should support spoken language development. Cochlear implants just also like the hearing aids, it needs troubleshooting and technical support in case of malfunction. Next is about FM system, frequency modulated system. It's one kind of assistive listening devices for classroom learning. So if you can see from the pictures, the teachers is acting like a DJ with a microphone, and she's wearing a transmitter to transmit the radio frequency signals to the child who has the hearing aids with a radio frequency receiver. So the signals is transmitted wirelessly from the teachers to the students with the device, hearing aids or cochlear implant. So with this system, the teacher's speech is loud and clear and direct to the child's ear. So it can reduce the background noise and let the child have the clear teacher voice so they can learn better. Okay. For this system, teachers must wear the microphone consistently so that the voice can be transmitted via the radio frequency to the students. Therefore, proper training is needed for teachers and frequency on how to use the system effectively, because they have to tune in the same frequency. It enhances the speech clarity, especially in noisy environment. As you can see from the pictures, the teacher's voice is directly to the receiver. So whether they are wearing the hearing aids or headphones or other devices, okay, but the sound of the teachers is directly to the students. So it can help the students to hear the teacher voice regardless where the teacher's positions in the classroom. For example, teachers can walk from the front to the end. The teacher's voice is still transmit to the hearing aids or the ears of the students directly. So bypass all the background noise. Next, sound field amplification system. This is the most common amplification system that you can see from the lecture room, tutorial room, conference room, whereby the speaker's voice level will be amplified and then distributed via the speakers to the entire room. So using this system, it is not so obvious for those who doesn't want to wear hearing aids, because they can still hear the amplified sound in the classroom. So the whole system's concept is to amplify the teacher's voice to the entire class using a speaker system. This will support all students, not just those with hearing loss. It will benefit for those with milder form of hearing loss, whether they refuse to wear hearing aids or not suitable to wear hearing aids. And also for those with attention problem. Okay, so as a whole, it will improve listening condition by distributing the sound evenly to the classroom. Okay, let's recap what we have talked about just now. So we have know how the ear works, how the hearing works, and how the hearing is quantified, and then what are the devices that are going to help in terms of hearing in the classroom. So let's go for an inclusive learning environment. Okay, how can teachers support students with DHH? So first of all, while speaking to the students, face them so they can get some visual cues on your facial expressions and the cues to understand what you have been said. Okay. Second, use your visual aids or written instructions for better understanding. Third one is to reduce background noise whenever possible. For example, you can see from the pictures, carpeted to reduce the noise level, or can use the curtain to absorb the noise, the reverberant noise. Fourth, encourage peer support and seating adjustment. So encourage their peers to speak more to them and to support their assignment. For example, when giving the instructions, help them. Okay, seating adjustments means whenever possible, arrange them to sit in the front row. Next one will be collaborate with parents and audiologists for better outcomes. So each child with the DHS is unique, as we all know that they might have different degree and type of hearing loss. Some is permanent, some is temporary, and some hearing will change because of the ear condition. So it's good to collaborate on meetings timely to know how's the status of hearing of the child and what intervention is the best for them to listen to teachers better at school for better communications so they can learn better. Okay, when to refer a student to an audiologist. So just now we talked about the signs of hearing difficulties. So if you see a child constantly, or a student constantly struggles to hear or understand speech, that might be the sign to refer for a hearing assessment. Second, if there are frequent complaints of ear discomfort, that might be another sign. The academic progress is impacted due to communication issues. If you observe that the academic progress is getting worse, and then they also have some communication problem, so that's the red flag to refer for a hearing assessment. So we're almost at the end of the topics today. So take home message. Collaboration is important among audiologists, teachers and parents to help the child with the students with the hearing difficulties. Teachers play a key role in recognizing signs of hearing difficulties at school. So early intervention is very important to improve the learning outcomes and classroom participation. So let's empower yourself to make ear and hearing care a reality for all. I hope you enjoyed the talks today. So thank you for your time, for listening. Thank you.
Thank you, Madam Au, for the informative speech. Before we proceed to our next speaker, let's enjoy a short video featuring our sponsor of today's webinar, MKS Medit. Now, we will proceed to our next keynote speaker. Our next speaker will be Associate Professor Dr. Rafidah Mazlan, University Lecturer, Audiology Program, Faculty of Health Science, University Kebangsaan Malaysia. Dr. Rafidah Mazlan is a dedicated lecturer, researcher, and audiologist specializing in pediatric hearing and healthcare. She received her Doctor of Philosophy from University of Queensland, Australia, and has since directed her expertise towards pediatric audiology and health and hearing health education. She is currently affiliated with the audiology program at the Faculty of Health Science, University Kebangsaan Malaysia, where she plays a key role in advancing pediatric audiology and hearing healthcare education and research. Dr. Rafidah has actively contributed for multiple research projects aimed at improving early hearing detection and intervention for children with hearing impairment, raising awareness about childhood hearing loss, and investigating middle ear measures. Her research also focuses on parental support in hearing aid management, digital learning intervention, and improving access to hearing care services. She has led multiple studies, including the development and validation of an online hearing aid management HAM module, which will be the focus of her speech for today. The module is designed to empower parents with the knowledge and skills needed to support their children effectively. Without further ado, please welcome Dr. Rafidah Mazlan.
Thank you, Fitri, for the introduction. Assalamualaikum and good morning, everyone. First, I would like to thank SEAMEO SEN and USM for this invitation. It is an honor to be part of this webinar, and I appreciate all of you for staying with us. So we just heard from our first speaker about how audiologists support children in schools, but what about parents? Parents play a key role but often struggle with hearing aid use and troubleshooting. Without guidance, it can feel overwhelming and stressful. That's why the right support is very, very important. Today, we'll be sharing how digital learning can provide the support parents need. Here is a quick look at what we will be covering today. We will start by exploring the common challenges parents face in managing their child's hearing aid. Then we will talk about why digital learning can be a game changer in providing the supports they need. Next, I will introduce the Malay Hearing Aid Management or HAM module, how it was developed, how well it works, and how it helps parents in real life. We will also discuss how the HAM modules empowers parents. And finally, we will look ahead to the future of digital hearing aid education, exploring ways to enhance the module and provide better support for parents on this journey. So before we dive into the key points, let's take a moment to understand just how common childhood hearing loss is in Malaysia. Here are some key statistics from local studies. As shown on the slide here, about 0.4% of babies are born with hearing loss. The prevalence increases to around 7% among preschoolers, and by school age, the number doubles to 15%. But these numbers may be even higher since our country lacks a standardized hearing screening. So without early detection, many children remain undiagnosed until their hearing loss start affecting their communication and learning. This also means that many parents only discover the issue later and may feel unprepared to manage their child's hearing loss effectively. Now let's take a look at one of the common intervention which have been touched by our first speaker, which is hearing aid. These devices amplify sound, helping children hear, communicate, and fully engage with the world around them. As mentioned, with consistent use, hearing aid supports speech and language development, but just having a hearing aid isn't enough. Its effectiveness depends on how well it is used and maintained. This is where parents play a crucial role. Their daily involvement by ensuring the device is worn consistently, kept in good condition, and functioning properly makes all the difference. Children who wear their hearing aids full time have a much better chance of developing speech, staying engaged in school, and communicating confidently. That's why parental commitment is key. With the right care and routine use, hearing aids can truly help children reach their full potential. But ensuring consistent hearing aid isn't always easy. Parents face many challenges, and one of the biggest is relying on printed manual for guidance. While these manuals are meant to help, they often use technical language that can be hard to lack visuals, making instruction difficult to follow, overload parents with information, causing key steps to get lost, and they are mostly available in English, which can be a barrier for many families in Malaysia. And last but not least, this printed manual can get easily misplaced just when parents need them the most. Another big challenge in this hearing aid management is getting parents actively involved. Even with the right information, many parents struggle to manage their child's hearing aid consistently because they lack confidence. They worry too much that they might handle the device incorrectly. Their busy schedules make it hard for them to prioritize hearing aid care. They don't always realize how crucial full-time use is for speech and language development. Emotional stress can make the process feel overwhelming, and they receive too much information during clinic visits. Studies have shown that about 40 to 80% of information that we provided to parents during these busy clinics is forgotten immediately, and even if they remembered, what they remembered may be inaccurate. Another challenge is that help isn't always available when they need it. Audiology appointment can take weeks, leaving parents waiting for answer. Clinic hours are limited, making it difficult to get immediate help, especially if an issue arises after hours or on weekends. This can add to frustration and uncertainty while waiting for the next visit. Traveling to clinics can be challenging, particularly for families in remote area, and not every problem requires a clinic visit. Issues like battery changes or whistling sound can often be fixed at home with the right guidance. So we have seen the challenges parents face. So how can we make this easier for them? This is where digital learning comes in. Instead of flipping through complicated manuals or waiting for clinic visit, these videos use real demonstration, making it easier to follow the written instruction. They are always available so parents can revisit them whenever needed. They provide instant solution, helping parents troubleshoot common issue at home. Imagine a parent struggling with a hearing aid problem at night or over the weekend. Instead of feeling stuck, they can simply watch a short video and fix the issue right away. We have seen how digital learning can make hearing aid management easier, but does it actually help parents? Research say yes. A study by Locaputo, Donnellon, and Clark in 2011, this researcher found that parents who use an instructional DVD retain information better than those relying on traditional materials like printed manuals or verbal instructions during clinic. This suggests that visual learning helps parents absorb and remember key information more effectively. Another study by Ferguson and Munoz, this study shows that e-health programs, which include online modules, instructional videos, and interactive learning platforms, significantly improve both parental knowledge and confidence. So all in all, these studies confirm that digital learning isn't just a convenient option, it is a proven, effective tool for empowering parents. So we have seen how digital learning can empower parents, but how do we turn this concept into a real effective tool? That's where the Malay hearing aid management module comes in. This module was carefully developed through three key stages. content development, production, and refinement. The first step was content development, where we identified key topics and learning objectives most useful to parents. We also gathered this information was gathered from research literature, create manuals, and existing e-health programs. To make the content practical and relevant, we created a storyboard and script, which were reviewed by special education and audiology experts. So once the content is, we moved to production stage, where the module was brought to life through real-life video demonstration. Using high-quality video and audio, we ensured instruction were clear, engaging, and easy to follow. The visuals were designed to be culturally relevant and practical for everyday use, making it easier for parents to relate to the content. And the final stage was the editing and refinement stage. In this stage, the module was reviewed by audiologists and parents who provided valuable feedback to enhance clarity and accuracy. We also included captions and visual highlights were added to reinforce key points, ensuring parents could follow along. Once the module was developed, what we wanted to ensure is whether it was truly effective and useful for parents. To do this, we conducted a validation test with both parents and audiology experts. For parent validation, 7 parents evaluated the module using the PMAT AV questionnaire or Patient Education Material Assessment Tool for audiovisual materials. And this tool is designed to assess how clear and practical educational materials are. As mentioned, it assesses 2 key areas, understandability, how clear and easy the content is to follow, and actionability, how well parents can apply the information in real life. The feedback we get from parents were overwhelmingly positive. For understandability, about 96% of parents agreed the module was clear and easy to follow, showing that the content was well structured and accessible. And for actionability, 100% of parents felt confident applying what they learned, proving that the module provides practical, useful guidance for managing their child's hearing aid. Apart from parents, we also conducted validation among experts, and we sought feedback from 7 audiology experts. And these 7 audiology experts evaluated the module using the suitability assessment of material instrument or SEM instrument. And this SEM instrument examined 3 main areas. Content quality, ensuring the information is accurate, evidence-based, and relevant to parents. The next key areas is literacy demand. They need to ensure that the language is clear, simple, and easy to understand. Last is graphic and layouts. They assess whether the visual that we included in the video is appealing, clear, and they also evaluated overall presentation for better engagement. The results were highly positive. The module received an excellent content validity index of over 0.83, surpassing the minimum threshold of 0.78 for expert agreement. So findings that we've got from parents and experts confirm that the HAM module is not only practical and easy to use for parents, but also meet professional standard in audiology education, making it a valuable and credible resource for hearing aid management. So I'm going to share you about the module. The module is structured into 6 key topics, starting with an introduction to hearing aid. In this introduction, it explained about the purpose of the module and how it helps parents. We also included an overview of behind the hearing aid because this is intended for pediatric patients, and behind the ear hearing aid is most frequently used type for this patient. And we also included a bit of explanation on the difference between analog and digital hearing aids. The next topic 2, dives into hearing aid components, explaining their functions, life lifespan and warranty. And we also included why regular maintenance is essential for optimal performance. For topic 3, it provides a step-by-step guide on how to identify left versus right hearing aids, how to turn and off the device, checking and replace the batteries, perform a listening check, and how to properly wear and remove the hearing aid. Since daily care is essential, topic 4 focuses on cleaning tools and techniques to keep hearing aid in good condition. We also included how to replace ear mold and when it is needed to replace the ear mold. And we also talk about proper storage guidance to protect the device. To help parents avoid common mistakes, topic 5 highlights action that could affect hearing aid performance. And finally, topic 6 introduces common hearing aid problems and provides simple troubleshooting steps so parents can fix minor issues on their own at home. So to keep learning simple and engaging, each topic is divided into short video segments ranging from 1 minute to 5 minutes. In total, the full module takes just 19 minutes and 20 seconds to watch. And for easy access and flexibility, the module is hosted on YouTube, allowing parents to watch, pause, and revisit lessons anytime they need support. So with both parents and expert validating the module's quality, the next step was to see how well it actually works in practice. So did the Malay Ham module truly help parents feel more knowledgeable, more confident, and more capable in managing their child's hearing aid? To answer this, we conducted a study with 53 parents who used the module. The majority of them were mothers, and 40% had a tertiary education qualification. Among the children, 98% had hearing loss ranging from mild to profound, and 79% wore hearing aids bilaterally. So to measure its effectiveness, we assess parental knowledge, confidence, and hearing aid monitoring skills before using the module 1 month after and 2 months after. So for knowledge, as you can see here, the knowledge increased over time, but the increment was not statistically significant. So the reason being is because among the 53 parents, we only have 2 new hearing aid users, which is defined as less than 1 year of usage, and the rest are experienced hearing aid users. So that is the reason why we have not significantly statistical difference between this aspect. So however, this suggests that while the module was helpful, maybe adding interactive features or extra material could enhance learning, especially for experienced users. One of the most encouraging results was the significant increase in parental confidence, as shown on the graph here. At both follow-ups, parents reported feeling more prepared and in control when managing the child's hearing aid because of the clear step-by-step video guidance helped them feel more capable of handling daily care. So for hearing aid monitoring frequency, we can see that there is a significant improvement at 2 months, meaning parents develop a consistent habit of checking their child's hearing aid over time. So the key takeaway from this study was that the Malay Ham module increased parental confidence and improved daily hearing aid care. But for knowledge, maybe adding interactive features like quizzes that could further enhance learning, helping parents develop long-term management skills. So apart from those knowledge, confidence, and monitoring skill, we also look at whether parents were using essential hearing aid care tools like stethoscope, battery tester, and air blower more often after completing the Malay Ham module. The results showed a clear improvement in daily care routines, as shown here. Stethoscope use increased from 59% to 71%. For battery tester, its use rose from 75% to 81%, and for air blower, the use went up from 75% to 84%. So all these findings confirm that the Malay Ham module did more than just improve confidence and skill. It is also encourage parents to take a more active role in their child's hearing aid care, leading to better long-term maintenance and use. So we have developed and tested the module. Now the next question is, how does the Malay Ham module can support parents? So one of the module biggest strength is its simple and easy to follow format. The short step-by-step instructional video break down hearing aid management into clear bit-sized lessons, making learning more practical and less overwhelming. Since the videos are available online, parents can watch, pause, and revisit anytime, allowing them to learn at their own pace and refresh their knowledge when needed. The module also reinforces consistent hearing aid use is so important. So from this, parents can gain a better or deeper understanding of how full-time hearing aid use can support their child's speech and language development. For troubleshooting and maintenance, the modules provide practical solution to common issues like battery problems, whistling sound, and proper cleaning. Parents also learn daily hearing aid check routines, ensuring their child device is always functioning properly and delivering the best possible hearing experience. Another key feature of the Malay Ham module is its accessibility. It is available in Malay with English subtitles, making it easier for more families to understand and use. Parents can also share the videos with extended family and caregivers, ensuring that everyone involved in the child's care is on the same page. And this creates a stronger support system at home. But most importantly, the module empowers family by giving parents the skills to handle minor hearing aids independently. So instead of relying on clinical troubleshooting, parents can resolve common concerns at home, and this will allow audiology appointments to focus on more advanced care and personalized support. So we have seen how the Malay Ham module has made a positive impact, helping parents gain confidence and skill. However, there is still more we can do to further support families on this journey. Okay, to strengthen its effectiveness, we plan to integrate the Malay Ham module into audiology care by incorporating it into counseling session. This will allow parents to receive structured guidance alongside professional support, ensuring they have both the knowledge and confidence to apply what they have learned at home. Additionally, we also aim to develop an implementation guide to help clinics and hospitals adopt the module. And to keep the module relevant and useful, we will continue gathering feedback from parents and professionals for ongoing improvement. We also want to make the module more accessible to a wider audience. Our future plans include adapting the content for different hearing aid types and age groups. To reach even more families, we plan to translate the module into other languages like Mandarin, Tamil, and other Southeast Asian languages, making it easier for parents from diverse communities to access this valuable resource. And lastly, we aim to enhance learning with interactive features and support by adding quizzes and self-check exercises, which will help parents reinforce their understanding. And for checklists and hearing aid logs, we'll assess them in tracking their child's hearing aid use more effectively. So as we wrap up, let's reflect on what we have covered. The Malay Ham module provides practical solution to help parents navigate the challenges of managing their child's hearing aid. with clear step-by-step guidance. It makes hearing aid care simpler, more accessible, and less overwhelming. And the impact is clear. Parents feel more confident and supported, leading to more hearing aid use and hopefully better outcomes for their children. But this is just the beginning. As mentioned before, moving forward, we aim to expand access, introduce interactive features, and integrate the module into audiology care, ensuring even more families benefit from this resource. All in all, empowering parents mean empowering children, giving them the best opportunity to hear, communicate, learn, and thrive. As we come to the end of this presentation, I would like to sincerely thank everyone who contributed to this initiative. A special dedication goes to our research team, Hanim, Firdaus, Izzati, and Alicia. I would also like to extend my deep appreciation for SEAMEO SEN for funding this research and helping turn the HAM module into a reality. And most importantly, a heartfelt thank you to all the parents and participants who took part in this study, and also to everyone who has supported this initiative in any way. Thank you. Here is a QR code for the Malay HAM module. Feel free to scan it, explore the content, and see how it helps parents manage their child's hearing aid. That's all from me. Thank you for your attention, and thank you again.
Thank you, Dr. Rafidah, for sharing with us on supporting parents in hearing aid management through digital learning. I hope we have gained something from her speech just now. Before we head to our next speaker, we will also like to share a preview of the online hearing aid management HAM module. So please enjoy the first chapter of the HAM module.
Hai, Assalamualaikum dan salam sejahtera. Pernahkah anda mengalami masalah untuk menguruskan alat bantu pendengaran anak anda? Jangan bimbang, kami ada jalan penyelesaiannya. Bagi ibu bapa yang tercari-cari penyelesaian untuk menguruskan alat bantu video ini. Video ini mengandungi modul yang lengkap untuk meningkatkan keyakinan ibu bapa dalam menjaga dan menguruskan alat bantu pendengaran. Penjagaan dan pengurusan alat dengan cara yang betul dapat memastikan alat sentiasa berada dalam keadaan baik. Ini penting dalam membantu perkembangan bahasa dan pertuturan anak-anak. Sebagai ibu bapa yang mempunyai anak bermasalah pendengaran, anda perlu jaga dan urus alat setiap hari. Pastikan alat dalam keadaan baik sebelum dipakaikan kepada anak dan disimpan dengan betul selepas digunakan. Bagi ibu bapa yang telah memakaikan alat bantu pendengaran kepada anak anda, tahniah kami ucapkan. Anda telah membuat keputusan yang tepat. Keputusan ini membolehkan anak anda memperoleh banyak manfaat. Ini adalah jenis alat bantu pendengaran yang biasa dipakai oleh anak anda. Alat ini dikenali sebagai alat bantu pendengaran jenis belakang telinga yang perlu dipakai dengan acuan telinga. Acuan telinga ini perlu ditukar secara berkala apabila longgar kerana saiz salur telinga anak anda akan berubah mengikut umur. Di pasaran, alat bantu pendengaran jenis belakang telinga terbahagi kepada dua, jenis analog dan digital. Bagi alat bantu pendengaran jenis analog, kebolehan memproses bunyi adalah sedikit terbatas berbanding alat bantu pendengaran jenis digital. Bagi alat digital, kemajuan teknologi menjadikan kualiti bunyi lebih selesa didengari dan mempunyai fungsi memproses bunyi yang lebih canggih. Untuk mengetahui jenis alat bantu pendengaran anak anda, analog atau digital, dapatkan maklumat daripada audiologis atau pembekal alat bantu pendengaran. Cara mengguna dan mengurus kedua-dua alat ini adalah sama. Tonton video seterusnya untuk mengetahui cara-cara untuk menjaga dan mengurus alat bantu pendengaran anak anda dengan betul.
all 6 chapters of the online hearing aid management HAM modules are available on YouTube. Ladies and gentlemen, now I would like to invite our third speaker for the day, Ms. Nur Fatehah Muhammad Shukri, to share with us on enhancing learning for deaf and hard of hearing students in Malaysia, features implementation of accommodations and modifications. A quick introduction of Ms. Nur Fatehah. She is a dedicated professional in the field of audiology and special education. Currently, she is a graduate researcher under the Master of Health Science, Audiology and Speech program at University Kebangsaan Malaysia. Her research focuses on the implementation of accommodation and modification in teaching and learning for deaf and hard of hearing DHH students, reflecting her deep interest in the integration of audiology and education. She earned her bachelor degree in audiology from Queen Margaret University, Edinburgh, United Kingdom, before furthering her study in a postgraduate diploma in education, special education learning disability at Institute Pendidikan Campus Al-Muhaz. Ms. Nur Fatehah then began her career as a special education teacher before moving to the Special Education Support Service Centre, 3PK, in Putrajaya as an audiologist. And in 2019, she was appointed as an assistant director under the Special Education Support Service Sector, Special Education Division, Ministry of Education, Malaysia. Now, without further ado, I would like to invite Ms. Nur Fatehah.
Hi everyone, it's a pleasure to be here today. I'm excited to share a part of my research titled Enhancing Learning for Deaf and Hard of Hearing Students in Malaysia, Teachers' Implementation of Accommodations and Modifications. Before we dive in, let me introduce my team. My name is Nur Fatehah binti Muhammad Shukri, and I am a graduate researcher under the Centre of Rehabilitation and Special Needs Studies, Faculty of Health Sciences. This research is led by Associate Professor Dr. Sila Umat, who is my supervisor and also principal researcher for this study. I'm also fortunate to have Dr. Farhah Khairuddin from the Faculty of Education as my co-supervisor and co-researcher. Now, let's get started. Introduction. Accommodations and modifications play a crucial role in creating meaningful learning opportunities and a positive environment for deaf and hard of hearing DHH students. Teaching and learning should be tailored to their abilities, ensuring they receive the support they need to thrive. However, effective implementation requires a holistic approach involving adaptations and modifications in materials, media, communication, instructionals, and other aspects of teaching and learning. This is not a task for teachers alone. It calls for a multidisciplinary team (MDT) approach, where teachers, as key players in the school setting, work alongside other professionals to support these students. In Malaysia, the implementation of accommodations and modification aligns with the Malaysia Education Blueprint 2013 to 2025, particularly its focus on access. This includes well-equipped facilities, comprehensive training for special education teachers, and collaboration amongst counselors, therapists, and teachers' assistants to ensure holistic support for students with diverse needs. By strengthening accommodations and modification, we can empower DHH students to reach their full potential. Despite the effort to support DHH students, there are still significant gaps in managing their education. One major challenge is the lack of continuity in intervention from health facilities to schools. The transition is often disconnected, making it harder for students to receive consistent support. A key reason for this could be the limited collaboration between the field of audiology and education. Without strong coordination, essential interventions and strategies may not be effectively carried over into the classroom. Another challenge is the lack of clear guidelines and resources for teachers. Many teachers struggle to find relevant reference to guide them in implementing accommodations and modification effectively. On top of that, existing resources may not be suitable for Malaysian context. making it even more difficult for teachers to apply best practices in a way that truly meets their students' needs. Bridging these gaps requires stronger collaboration, better references, and resources tailored to the Malaysian context to ensure DHA students receive consistent and effective support. Research question: what are the accommodations and modification practices implemented by teachers in teaching and learning at school in these recent 3 years? And the research objective is to identifying the existing implementation of accommodation and modification practices in teaching and learning DHA students by teachers in school in these recent 3 years. Methodology. This study uses a mixed method approach combining cross-sectional study and focus group discussion. In the cross-sectional study, we focus on teachers of DHA students in Melaka, Pahang, Selangor and Sabah. A Malay version of accommodations and modification checklist for DHA students consisting of 69 items across 8 sections was emailed to school in the States. The checklist covers key areas such as personal and assistive hearing technology, communication, instructional strategies, physical environment, curriculum, evaluation, and more. For analysis, we use binary scoring, assigning 1 for yes and 0 for no. This method helps us understand how accommodations and modifications are implemented in classrooms, providing valuable insight for improving support for DHA students. In addition to the survey, we conducted 3 focus group discussions, FGDs, with 12 teachers from different special education programs, which are Special Education Schools, SES, Special Education Integration Program, SEIP, and Inclusive Education, IP. Each session focused on key aspects of accommodations and modifications, including teachers' understanding of these strategies, implementation in schools, observed effects or changes in students, challenges teachers face in applying these strategies. This discussion provided valuable insight into real classroom experiences, helping us understand both the impact and challenges of accommodations and modifications for DHA students. Result: a total of 151 teachers participated in the cross-sectional study. The majority, 66.9%, equal to 101 teachers, were from Selangor, followed by Melaka 19, Pahang 10, and Sabah 21. In terms of teaching programs, 50% were from SEIP, 35.1% from special education schools, and 13.2% were inclusive education teachers. The mean individual score on the checklist was 50.95, with scores ranging from 12 to 69. The low minimum score of 12 suggests that some teachers implemented very few accommodations and modifications in their classrooms. This finding highlights the variation in implementation and the need for better support and guidance to ensure all DHA students receive necessary accommodations. Item scores, the good ones. The highest implementation was seen in the communication aspect with 85.4% to 99.3% of teachers applying these strategies. This includes seating arrangement to support better access, getting students' attention before speaking, minimizing distractions in the classroom, providing extra time for tasks, presenting information in a structured way, speaking clearly, using repetition and rephrasing, offering interpretation support when needed. These strategies show strong commitment from teachers in ensuring effective communication for DHA students, which is a great step forward. While communication strategies were well implemented, hearing technology needs more attention. More than half of the teachers did not apply these strategies. 67.6% reported no implementation of classroom sound distribution systems like TILO. 62.3% didn't use warning devices, and 53% to 58.3% did not implement strategies related to personal hearing aids and hearing instruments. This highlights the need for better awareness, training, and resources to help teachers integrate hearing technology effectively in their classroom. The classroom environment needs attention, especially in reducing noise and echo. Many classrooms lack materials that absorb sound, making it harder for DHA students to hear clearly. Also, the use of technology in teaching is still limited, showing the need for more digital tools to support learning. Improving these areas can make a big difference for DHA students. Evaluation and curriculum also need attention. This study highlights the expanded curriculum, which provides important guidance to help teachers and students better understand the needs of DHA students. Strengthening this area ensures more inclusive and effective learning for them. Our focus group discussions, FGD, reveal 8 key elements, including assistive technology, communication strategies, and curriculum appropriateness, and so on. For instructional adjustments, teachers discuss how they give instructions, the materials, equipment, and tools used in lessons, and the buddy system to support DHA students. These insights help us understand how accommodations and modification are applied in real classrooms. Discussions. Our analysis shows that teacher training is crucial since many have limited knowledge about assistive technology and audiology related terms. Training should include SES, SEIP, and mainstream teachers as more DHA students now use hearing devices. There are also misconceptions about hearing technology. For example, one teacher was excited when her school received a personal FM system but couldn't use it because the DHS classroom was near a busy road, noisy canteen, and other classrooms. However, FM systems are designed to help students hear better in noisy environments, showing a need for better understanding and training. By bridging these knowledge gaps, we can ensure better support for DHA students. Well done to our teachers. They have successfully implemented communication strategies and adapted instructions to suit DHA students' abilities. However, there is still room for enhancing educational tools and devices to better support teaching. Teachers working with sign language users put a great effort to prepare materials, often spending extra time adapting content, adding signs, and adjusting learning materials, especially for language subjects. Providing more ready-made resources could ease this process. We also observe flexibility in evaluating DHA students in special education school and integration program, and there is potential to extend this practice to mainstream classroom for a more inclusive approach. Our findings reflect positive progress in line with the Malaysian Education Blueprint, and with continued efforts, we can further strengthen support for DHA students. Before I end, I'm excited to share a guide for teachers on implementing accommodations and modification for DHA students, a key part of my master's project. Inshallah, it will be available soon. Here's my amazing team behind this effort. We truly hope that panduan akomodasi dan modifikasi pengajaran dan pembelajaran murid berkeperluan pendidikan khas ketidakupayaan pendengaran will be a valuable resource to help teachers better support DHA students in their learning journey. Thank you. Thank you very much for your time.
Thank you, Ms. Nur Fatehah, for the informative speech. Ladies and gentlemen, before we proceed to the next session, I would like to share some announcements. I am thrilled to announce that SEAMEO SEN Biennial Event, International Conference on Special Education, ICSE will be held from 26 to 27 July 2025 in UCSI Hotel Kuching, Sarawak, Malaysia. With the theme of Technology for Disabilities, A Path to Inclusion, join us for a transformative face-to-face experience as we spotlight the power of technology to create inclusive and engaging learning experience for all. This conference will feature innovative competition, multi-stakeholder panel discussion, policy dialogue session, as well as workshop, research presentation, and exhibition. Don't miss out this chance to network, learn, and inspire changes as we advance SDG 4 for quality education, promoting inclusive, equitable, and accessible learning for all. For more information, you can visit our official website at icse.seameosen.edu.my. Now, for a preview of what you can expect during ICSE, please enjoy a short video presentation highlighting our previous edition of ICSE held in 2023. Ladies and gentlemen, we will now proceed with our forum session with a topic focusing on empowering hearing healthcare in special education, the Malaysia Perspective. The forum will be moderated by Dr. Muhammad Fazil Nur Rashid, SEAMEO SEN resident expert and university lecturer at Audiology Program, School of Health Science, University Science Malaysia, and will feature our three keynote speakers, Associate Professor Dr. Rafidah Mazlan, Madam Cheu Lih, and Ms. Nur Fatehah Muhammad Shukri as panel. Now, allow me to invite our esteemed moderator to take over in moderating the session. Dr. Muhammad Fazil, the floor is yours. Dr. Fazil, your mic are on mute.
Oh, sorry. Okay, I start again, Mr. Firi, I'm really sorry about that. Okay, Assalamualaikum and very good day, everyone. Welcome dan selamat datang to the SEAMEO SEN USM World Hearing Day webinar 2025. We are truly honored to have you all here as we will discuss about an important topic about the empowering hearing healthcare in special education, the Malaysian perspective. Okay, before we begin, I would like to extend my appreciation to SEAMEO SEN and University Science Malaysia, USM, for organizing this meaningful event in conjunction with World Hearing Day 2025. Okay. This year theme set by the World Health Organization, changing mindset, empower yourself to make ear and hearing care a reality for all. So this aligns perfectly for our webinar today or our forum to increase the awareness, the sharing best practice, and also fostering a collaborations to improve hearing healthcare, particularly in special educations. Okay, before we start our panelists, I would like to introduce again our panel. Actually, they have present before this. Our first panel is Madam Cheu Lih, a lecturer. Then she had present about the topic about supporting every child's hearing, the role of audiologists in educational settings. And then our second panelist is Associate Professor Dr. Rafidah Mazlan from University Kebangsaan Malaysia, a university lecturer. She also present about the supporting parents in hearing aid management or HAM through digital learning. And then our third panelist is Ms. Fatehah Muhammad Shukri, also from UKM, is a graduate researcher from UKM. She had emphasized, she had discussed about the enhancing learning for deaf and hard of hearing student in Malaysia, teachers implementation of accommodation and modifications. Okay, so I hope each of the presentation before this have bring a lot of knowledge and sharing the expertise to the discussions. I'm sure we will all gain valuable information from them. So let us begin with our first panel. Okay, Madam Cheu Lih. Okay, in your presentations, sorry, before that, we will be doing two round of forum. First round will be the question is from me, and then the second round we will pick up a question from the audience. for each presenter or for each panel. Okay. Okay, Madam Cheu Lih, in your presentations, you have mentioned, I think, slide 10. Okay, you have discussed about the type of hearing loss. You mentioned about the conductive hearing loss. You mentioned about sensory neural hearing loss and also mixed hearing loss. Okay, so the typical question from parents, from the teacher, they mention about the child who has no ears, meaning there will no pinna, no opening of the ear. And then, so the question that may be asked from the teachers, they will ask, is my children or is my student can hear? Or what is the type of the hearing loss that typically this child had? And then also, what is the best management for these kids? Okay, Madam?
Thank you, Dr. Fazil. It seems like a very common question. So, yeah, typically when absent of the ear, they can't hear that well. So it depends on which structures of the ears that has is absent. So as in the slides, I also mentioned the structures of the ear that we have the outer, middle, and inner ear. So typically for those who has absent pinna, the conductive, the function of collecting the sound and transduce to the ear is impacted. So usually they will have conductive hearing loss that they will need to wear hearing device. However, because the absence of pinna, they cannot use the conventional hearing aids as shown like the behind the ear. So they'll have to wear something like bone conduction hearing aid that transduce the sounds via the bone conduction route. So in the school, because perhaps in the school they will without the hearing aids, if they have absent both ears, without the hearing aids, the bone conduction hearing aids, they might not hear that well. So they need to have their hearing checked. That's why the important is to get the hearing check first to know the degree of loss and see what kind of intervention and supports that we can give to them. So that's most likely that's all from me.
Okay, Madam. So what is the best management typically for this kid actually?
Typical management is depends on whether their inner structures, that means the cochlear inner parts of the ears, is intact. If intact, bone conductions hearing aids is helpful. If when they grow older, perhaps they might need surgery for reconstruction. So, and that maybe their hearing levels will be different and depends on the situation and the degree of loss after the intervention. Perhaps they might still need the hearing aids and also the assistive listening devices at school.
Okay. Thank you, Madam Au, for a very quick, very brief answer. Sorry. Okay. Okay, let's take another perspective from Associate Prof. Dr. Rafidah Mazlan. So earlier, Dr. Rafidah mentioned about three main common challenges. If I'm not mistaken, it's slide number 5. You have mentioned about when dealing with hearing aid management, we need to focus on if we focus on the parents' perspective, and then also based on your experience, can you give at least 3 examples of the most common challenges reported by parents regarding hearing aids management?
Yeah, thank you, Dr. Fazil, for the question. Okay, through my clinical experience working with parents of children with hearing loss, so one of the common challenges that we face is inconsistent hearing aid use, where we see that some parents bring their child to clinic without wearing their hearing aid. So this is common, okay? And this is happened because maybe they are unsure how long the hearing aid should be worn. This is like knowledge. And maybe the child resists wearing them So parents keep on reducing wearing time or skip using it altogether. Or when maybe parents don't see because to develop speech and language development, it takes a long journey. Okay, like baby, they can only talk from birth only up to 1 year old. They can speak one word. So for parents, maybe they don't see immediate benefit and they assume hearing aids is not necessary. Okay, and how do I address this? Usually, we counsel parents on the importance of consistent hearing aid use. At least, we encourage them to put the hearing aid on for at least 8 hours for speech and language development. And we also explain about the inconsistency. We can slow down the progress because our brain and the child brains need consistent sound input to learn. Okay. And the second challenges is whistling or feedback sounds from hearing aid. Okay. This is usually cause loose ear mold that don't fit snugly into the child's ear, and it is because common among children because the ear will grow, so they need to change ear mold quite often. Or maybe parents did not insert the ear mold properly. So again, what we usually do, this is common in audiology, and for all audiologists, we we check first to look whether it is really loose ear mold or because of uh, not properly placed ear mold. And if it is not properly placed, what we can do is we teach parents of proper insertion. Okay. And the third thing is some parents worry when ear turn red or feel sore after wearing the ear mold or quite sometimes. So this is because of the friction of the image. Sometimes the materials is quite hard. So what we advise parents is we teach parents to apply a thin layer of Vaseline around the ear mold to reduce friction or irritation. And regarding if your question is related to ham module, the Malay ham module, one of the common challenges faced by our participants is the video traffic. The traffic of the video is too slow. The loading time is too slow, and it it includes a lot of buffering. Okay. Maybe because of during that time all parents log in and watch the video at the same time. So the most fast solution is we encourage parents to rewatch the video during non-peak hours. Okay. But in future, maybe we need to upload the module instead of YouTube. We need to find any other platform to upload the module so that we can reduce the traffic congestion. And hopefully, maybe we can provide or we can adjust the video quality instead of giving a very high resolution. Maybe we can go down to a low resolution. So that's all from me. I hope I answer your question, Dr. Fazil.
Yes, correct. Just one question, Dr. Rafidah. Some parents mention about they worry that because the Euro is too expensive. It's not too expensive. It depends on the model. It depends on the technology. Yeah. Some parents will mention about I'm worried when my kids wear the hearing aids during the playtime, kan? And then worry that the hearing aid will damage or lost. What do you think? How are we going to what is it to counseling to the parents about these issues?
So about that issue, we do have accessories so that can make the hearing aid stay on if it is fall down from the child's ear. So that is one of the suggestion that we can give to parents. So to avoid to make them less worry if the hearing aid falls down and it broken. So we use accessories. I can't remember the name of the what is it, Dr. Fadil?
What is it? I forgot about name.
We can have something that we can
Like a clip.
connect to the clip, the ear clip, yes, the ear clip, the hearing aid clip, yes. Okay.
Okay. Thank you, Prof. Rafidah, for that opinion and the talk. So based on the ham, also you have how long that you have developed this ham, Prof. Rafidah?
So for this Malay module, because it is funded by SEAMEO SEN, SEAMEO SEN gave us only 2 years to complete everything. So
Okay.
for the development, we spent about 7 months to get the final version of the Malay module.
Oh, okay. It's a long time. It's a long.
Yes, yes.
Mhm.
So because
Yeah.
we have validation before we validation process development, so that's why it takes a long time. So actually we extended our research instead of 2 years.
Okay.
CMSN is agreed to extend our research to 2.5 years. So
Oh,
that's why we were able to complete this Malayan module because the
oh,
development process take quite some time to finish.
oh. Okay, thank you, Prof. Rafidah. Okay, we move to our third panelist. Okay, for Ms. Fatehah, I believe that you have mentioned in your slide earlier that you have mentioned you have done a great job by interviewing 12 teachers who dealing with DHS students or deaf hard of hearing students. Can you just maybe you can just explain or elaborate further regarding your findings about the implementations and also the effect or changes that you have observed during your session or during your research. Uh,
Right.
okay.
Right. Okay. Thank you, Dr. Fazil. Okay. About the implementation, impact and the effect of the implementation. And from our findings, we found out that the implementation give a positive changes and impact, especially to the teachers and also to the DHA students in schools. Okay. The implementation that usually that teachers be done, the first one is the communication. Other than that, about the teaching methods and also the use of assistive technology. Okay, one of the teachers, not one, it's more than a few teachers stated that they can see the impact when they teach reading skills or literacy for the kids, especially for those who wearing hearing aids or hearing devices. That's different compared to students that not wearing any device. Okay, the teaching become more easier and also effective among this group of students that's wearing the hearing aids now. And this is because when the students wear hearing devices, they can hear the teacher's voice, they also can repeat and also can pronounce the words itself, and together with signing. So the signing for the population in special education school and SEIP lah. So teacher can see the difference when the students wear the hearing devices. And this also helps in spelling and also to improve their language skill. That's the first part. That's very the brief observation from the teachers, and it shows that the importance of wearing hearing devices. Okay, and the second one, this is from teachers from mainstream. Okay, these teachers mentioned about she taught these students for 2 years in mainstream in the secondary school. In the first year, she didn't realize that these students have hearing problems, and that only in the second year she realized and acknowledged about that. And then when she know that the students having hearing problems, this teacher try to find information and try to understand the students and the needs for the special needs for that students. So from that, what we can see from that, the teacher said, after she understand and accept the students' ability, then the students also feel more comfortable with her. And then she implement that, she repeat the questions, she paraphrase and also give a simple instructions. Just made a few modification in the instruction given, and
the students show a very positive, we can see that from the behavior lah. And so from that, the teacher said the students more comfortable and it boosts his self-esteem. In the, for example, in the presentation, before this student just a very quiet and reserved student. But after this, the teachers acknowledge and also support him in his study or in the teaching and learning session, these students show a great improvement, which is he volunteered himself to the front of the class to present for the English subject, which is English subject for Malaysian second language. So that's very great, and she actually very happy with that improvement just because of the small strategies that she implemented. Okay.
Okay, good. That means a lot of the more to like a positive effect, right? Positive effect towards for the kids and also for the teachers. Is there any maybe some what do you think about sometimes they got a negative effect also? But because you have mentioned sometimes, yeah, we for sure we want a positive effect, kan? But is there any? It's not a negative lah. For me, we call it challenges or limitations doing that. What do you think about that, Fatehah?
Yes, that's the positive side. Okay, so then about the negative side, they have to, as we found that communication is the niche where the teacher implement more strategies for the students. Maybe because it's the most common and easier part, but teachers are really struggle to understand and get information about the hearing devices such as hearing aid, cochlear implant, FM system, and other sort of hearing technologies. So teachers, okay, from what we interviewed, teachers said even mainstream or special education teachers in SEIP or SES, all of them claim that they have very limited knowledge about hearing devices and they need training about that. And they say they can support the students because they also don't have adequate information about it. And most of them also say they are afraid because the hearing devices are expensive. That's one of the things that we usually found at school. So the challenges that that teachers mentioned, it's really related to the hearing devices. So maybe this the part that something need to be done about it.
Okay, actually you're answering my second questions. So meaning that I just conclude your explanations. That means the teachers need an audiologists to come to their school to teach how to handle the hearing aid or what, Fatehah? Or they just need what is it, hands-on session or what do you think about that?
I think the first part, yes, teachers really need the training about that. But we know there's circumstances that have the limitation about that. But I think the first or small part that we can do is close the gap between the health facilities and schools when managing the students. And it is about the continuity of intervention from the health facilities to schools. Because what we can do, the first step, I think the audiologists or from people from health facilities can give information to teachers. But usually we give that information without, we realize that that's the information given in a language that teachers understand. That's one of the things that we found out. Teachers say, yes, we just write it down, mild hearing loss or moderate hearing loss. But what does it mean by that? So teachers need more information about that. Or maybe in our notes or information given from the health facilities to school, we just use easy language or more user-friendly language. That's the first thing that I think that we can do. And about the training, involvement of health facilities, universities, and also school is very important. And from that, the training can be both. So the health facilities, individuals or universities get information from teachers, and teachers also get information from the this group. Because from that, we conducted, we brought the information from university and our research, the research-based part. We conducted 5 workshops with the teachers. And from the workshop, we give the all the information about accommodation and modifications, and also about the hearing devices. And at the same time, we give the chance to touch and use the hearing aid. And most of the teachers say they never hold the hearing aid and just see the hearing aid because they're really afraid to manage that hearing aid. So from that, as the exposure we give to the teachers from I think the universities and also hospitals, the teachers more confidence to manage the hearing devices. So that's the thing that we think we need to do something about it.
Okay, thank you, Fatehah. So that's mean we would like to minimize. I think that minimize the gap. Minimize the gap between, let's say, is audiologists and the teachers. So with this approach, with your suggestion, I think we can minimize. It's not close the gap, but at least we can minimize the gap between all the special need education teachers out there, lah, right, Fatehah?
Yes, exactly, Dr. Fazil.
Okay, thank you, Fatehah. Before we move to our second sessions, I would like to make an announcement. We also encourage the audience to be part of these discussions. If you have any question, anything that you want to ask for the panelists, please feel free to type all the question in the chat box. We will address as many as possible during this time, during the next sessions. Okay, we also have a few questions during the presentation. During that previous presentation, we have collect a few questions from the audience. I would like to invite. I think the first question is for Madam Cheu Lih. The question is I'm not so sure from who, but thank you for asking the question. The question is, apart from hearing aids for hearing impaired children, is there any assistive technology that can support these children? Madam, do you have any opinions about these questions?
Okay. Thank you for the questions. So for this question, it's quite typical and general as a whole. So as mentioned in the presentation just now, because every individuals with the hearing loss have different degree of hearing loss. So different degree, they might have a different impact. So moderate, severe, profound, they'll have difficulties in understanding speech in a normal level. So those with more severe hearing loss, they may need the hearing aids more. But for mild loss, perhaps they don't need the hearing aids in quiet situation. So assistive listening device can help them. So for assistive listening device, there are a lot of variations. So one of them is the one FM system, the sound field amplification system, and you can go for alert system, or you can use your mobile phone to transcribe the speech into text. So there are many ways to help them. So in the school, perhaps the mobile phones is not so encouraged. So the FM system, ALDs, will help them better to hear the speech from the teachers and then can bypass all the background noise. So the most important thing is to hear the teachers teaching, the voice of teachers clearly in the classroom so that they don't miss the teaching, and especially when it comes to assignments. So one of the my study about also interview teachers in the mainstream classroom, they also find it difficult as in instruction. So they need to go to the child to tell them again. So besides the ALDs in the school, perhaps they will have the peers, like the peer sitting beside them to help them to jot down the assignment and then tell them what's the assignment for today so they don't miss it. Okay, so about alerting devices, so is quite important for those with hearing problem. For example, those with the visual lightnings, everything at the school. So to help them, there are many ways. Just that depends again. Not every child have the same degree of hearing loss in the same classroom. Perhaps you have to strategize it. So that's the best. The best way is to collaborate with audiologists, and then we can think of the best strategies for them. Okay, I hope I answered the questions.
Yeah, thank you, Madam. But my questions, I think you answered the question, but you had mentioned about the FM system, right? FM system may help the student with hearing impairments. In based on the maybe you also have done a few research in mainstream school, right?
Yes.
When you mentioned about the FM system to the teachers, how was their response? I mean, especially for the teachers. Yeah.
For the teachers, perhaps they don't quite familiar with the hearing device. Some also don't know whether the child is wearing hearing device or not. They are more concerned about their communication mode, whether the child can speak or can hear clearly. Because the study that I've done is in a mainstream classroom, so probably they have more. Some can speak, but some cannot. So they have a different groups of subjects in the comments, so which is very hard to conclude here.
Okay, now, one more thing you have mentioned about peer support. Do you want to elaborate further about that, peer support?
Yeah, peer support is very important because one of the teachers also mentioned that if the child who has a group of friends that playing together, especially those with verbal, with a cochlear implant or hearing aids, they are more happy. They are more happy. They can see the difference from the early year, and at the end of the year, the child mingle together, and the supports that they have from the peers. The child is very happy, and the teachers also happy to see that. Okay, which is very important for all the activities at school.
Yeah, so means that the peer support is not just for teaching and learning, right? Sometimes for sure at school they only teach and learning, but sometimes for their social, at the
Yeah.
canteen,
Yes.
mungkin at the toilet or whatever they have done during what is it we call it sport times, right? So they also need a peer support to help the teachers also to help teachers managing the kids with the hearing impairments. Okay, thank you, Medao. I think I will collect the second questions from the audience. I think Prof. Rafidah already mentions during the presentations. One of the two questions, maybe Prof. Rafidah can explain a little bit further about HAM. The question is, in Malaysia, where and how to get the module of HAM, hearing aid management, do we need to purchase that HAMs? Mungkin the audience missed the information. Mungkin Prof. Rafidah can explain a little bit further about your module that you have developed with the SEAMEO SEN.
Okay, thank you, Dr. Fazil. Let's start with the cost first lah kan. So the Malay HAM module is freely available for everyone. Okay, and hopefully to those who ask the question, you managed to scan the QR code that I share just now. And if you don't, what you can do is you can be promoting my UKM audiology program. So what you can do is you go to YouTube, okay, you search for audiology program, Faculty of Health Sciences, okay. So under that page, okay, there are two tabs. One is video and one is playlist. So all the videos are, all the topics are available in the videos as well as the playlist. So the much easier one is you go to playlist because all the 6 topics are there compared to the videos because there are other videos from our program activities. So you go to our UKM Audiology Program Faculty of Health Sciences YouTube page, you go to playlist and you can watch all the 6 topics freely. And it's you don't have to pay for the module. Okay.
Yeah, thank you, Rafidah. It's okay to promote UKM or whatever. It's okay because although I'm from USM, that's the thing that we sometimes we are not fighting each other. Who is the
Yeah,
best? Who is,
yeah. We work together. We are not fighting each other.
yeah,
We work
yeah.
together as a Fadil.
It's okay, but that's the thing interesting. But like a Pro Rafida, sometimes we discuss a little bit some cases, some opinions. Sometimes we discuss about everything. Because we need a collaborations between USM, UKM, or whatever lah. Okay, okay. Just to add one more question, Pro Rafida. Why you develop this module actually?
The reason why we develop it because it's now it's all about digital. Nowadays, it's all about digital. So we want to provide our parents or maybe teachers can also use this module at their fingertips because at the moment the only materials that we've got is hearing aid manuals. Not all can access the hearing aid manual. Only for those who buy hearing aids can access the manuals. We don't have module for hearing aid management. Okay, so our aim is to develop this, and we started off with giving it to parents because we work with parents a lot, and hopefully we can give other agencies like teachers or maybe anyone who are involved with the care of children. Maybe I don't know. Maybe it can go to we can give it to mainstream school because our hearing impact children also go to mainstream school, and it can be shared with maybe the normal their peers as well.
Okay, what is your future planning with this model, Rabra, if you don't mind to share with us lah?
Oh,
What is
like I mentioned, this is not my future planning. Our immediate plan with SEAMEO SEN is actually we agreed to translate this into Southeast Asian countries' languages.
oh,
11, if I'm not mistaken, countries. So that is what we plan, our immediate plan with SEAMEO SEN, because we want to distribute it to wider population. So that's what. But then SEAMEO SEN consists of many countries, 11 countries just now. So
yeah.
that's why we aim.
Oh, okay,
That's
that's
our
a
aim. Mm-mm.
yeah, that is a great news for especially for the SEAMEO SEN also. Thank you, Rafida. Okay, I took one other question from the audience. I think this one is for Fatehah. I think as I mentioned earlier, the importance of the collaborations between special education teachers, university, and also a hospital. Actually, all of us is audiologists, right? All of us are audiologists, but different setup lah. Okay, so what do you think? How are we going to enhance these collaborations between us to improve the hearing healthcare services for the student? It doesn't matter. It's maybe a mainstream school or sometimes it's for the teachers also. Why do you think the collaboration that needed to enhance the collaboration between us? Fatihah?
Right, about the collaboration between agency staff, we can say that I think that collaboration, it can be from both ways. It's either from school direct to the audiologists or universities. Usually audiologists are in the health facilities, because the audiologist is it's like kind of more close with the students and know the students better, and then that information can directly go to the teachers rather than go to any other places, and it just direct from teachers that students teachers directly to the audiologist, which means like school hospital. It can be that way, and it can be done by it's either hospitals can provide information for the teachers, And at the same time, teachers also can provide information to the health facilities. So it's easier. So both the continuity from the health facilities happened and occurred in both situations. So both of individuals or the professionals get the same information and share this information about the students, and it's more what we call that the MDT, multidisciplinary team. So it's the multidisciplinary team can work closely together. That's one of the way. And other than that, the involvement of the policymaker. Okay, the involvement of policymaker is crucial, I think, because information from universities, especially about research-based findings, is really important, so that the policy will be jive together with the research-based information. So one of the things that I think we need like improvement in terms of evaluation or examination. For now, most of our students, especially DHS students, wearing hearing devices, and they are in the mainstream school. But the examinations support is really limited for them. So the information or research-based information and findings should be shared with the policymakers, so that the things that can be done. So what I can say, the collaboration must be from top down and down to top. So it can be, it's not from one side only.
Okay, you have mentioned about multidisciplinary approach lah, or multidisciplinary team. So in Malaysia, I know that Fatehah is from 3PK, 3PK. How can you comment a little bit about the 3PK, mungkin their job or their tasks for the kids?
Okay, so 3PK, which is Pusat Perkhidmatan Pendidikan Khas atau Special Education Support Service Center, is a one-stop center. And in the center, we have multidisciplinary team, which is we have audiologists, speech therapists, occupational therapists, psychologists, we can be psychologists, clinical psychologists, and also educational psychologists, physiotherapists, and also learning interventionists. Okay, we work together because in the 3PKs, we get referrals from parents, from teachers, from schools, and also from hospitals actually. So when we got the what we call the client or patients, we will look the patient as a whole from different perspective. For example, a deaf student come, then the audiologist must be the person, the professional will be managing that students. But if the students have another needs, such as support in terms of learning, and then we can refer directly to it's either psychologist, it can be educational psychologist or clinical psychologist. But at the same time, when I said about the multidisciplinary team, we can't just forget teacher as part of this multidisciplinary team. For now, we have to emphasize that teachers is part of the MDT team, so that the information and from the it's either from 3PKs or health facilities can be shared with the teachers, so teachers can support more students and support better at school. So that's the thing that 3PKs do so far.
Okay, thank you, Fatehah, for sharing about the 3PK in Malaysia. Okay, so I think because our time limited times, so I think I have to conclude the forum sessions. I want to take the most important thing that the output of this webinar. We hope that all the teachers, all the healthcare professional, or whatever, in the hospital, in the university, or in the school also, we hope to collaborate with others, and also feel free to contact to contact SEAMEO SEN, maybe to contact USM or to contact UKM, also contact to Fatehah, also 3PK, to deal or to make and what is it we call it? It doesn't matter, it's an event or to check the hearing, to make a simple bengkel, also sorry, to make a simple workshop. To improve the knowledge, to improve the what is it we call it, anything else that we can help the school children. It also before I end, again I would like to thank SEAMEO SEN and USM and also all the industry partners for organizing this webinar. We hope that we can continue working together to empower the hearing healthcare for all. Okay, thank you again, and I wish you all a meaningful World Hearing Day 2025. Okay, I will pass back to Mr. Fitri, the MC for the today's event. Thank you, Mr. Fitri.
Thank you, Dr. Fazil, for moderating our forum session just now. Ladies and gentlemen, let us now listen to the closing remarks from Professor Dr. Muhammad Nurmani Zakaria, Chairman of Audiology Program, School of Health Science, University Science Malaysia. Prof. Dr. Muhammad Nurmani Zakaria, the floor is yours.
Thank you, Chairperson. Madam Jamilah Kadir, Director, SEAMEO Regional Centre for Special Education Needs or SEAMEO SEN, Professor Dr. Wan Rosli Wan Ishak, Dean of School of Health Sciences, University Science Malaysia, Dr. Muhammad Fazil Nur Rashid, Director of World Hearing Day 2025, Committee members of the World Hearing Day 2025, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh and warm greetings. Syukur Alhamdulillah. Praise to Allah Subhanahu Wa Taala for His grace in enabling us to participate in the World Hearing Day 2025, a collaboration effort between University Science Malaysia and SEAMEO SEN. We appreciate all of our distinguished speakers who have discussed the essential issues under the theme of empowering hearing healthcare in special education. I believe that today's program has enabled all the participants to gain a better understanding of hearing healthcare and inclusive education for children with hearing impairment. Ladies and gentlemen, it takes great effort to bring all professionals together to share their experiences, knowledge and evidence-based practices in the hearing and education for children with hearing impairment. In the past, education for children with hearing impairment only focused on providing sign language and cue speech. Families seem to resist enrolling their special education needs children in formal schools, indirectly thinking that our system was incapable of supporting their education and developmental needs. Through the hearing awareness campaign, we aim to provide better hearing healthcare and the implementation of effective procedure for assessing and managing those with hearing loss. In year 2022, 33% of children with hearing impairment were enrolled in the inclusive education offered by the Ministry of Education Malaysia. And this has increased to around 34% in the year 2023. This small increment has demonstrated that parents are more aware of the hearing healthcare and try to ensure that their children receive the available opportunities. Apart from that, the universal hearing screening programs have been implemented in many hospitals in Malaysia, including those in the public hospitals and university hospitals, so that we can identify hearing loss as early as possible. Ladies and gentlemen, it is my hope that this program will strengthen the existing relationship while fostering new collaboration towards improving hearing healthcare. Indeed, this program provides a useful platform to develop and engage Malaysian and Southeast Asians. Last but not least, I would like to express my gratitude and congratulations to the working committees of this program which includes dedicated staff members from the Audiology Program and Audiology Clinic, University of Science Malaysia, and SEAMEO SEN, as well as our industrial players. Thank you again for your kind presence. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Dr. Muhammad Nur Zakaria, for the inspiring speech. We have now come to the end of our webinar. I hope we have gained new knowledge as well as awareness on hearing healthcare in general, and specifically within the special education. Ladies and gentlemen, I'm pleased to inform you that the evaluation link has been activated. Our participants can start accessing the evaluation form starting now, but please be reminded that you must complete the evaluation before 12 midnight Malaysian time to qualify for the event certificate. The event certificate can be downloaded right after completing the evaluation form in our SIES site. For more updates on future programs, you are welcome to like and follow SEAMEO SEN social media pages on our Facebook, Instagram, X, LinkedIn, as well as TikTok. And for more updates about audiology program in University of Science Malaysia, you can head to health.usm.my or on Facebook at Audiology Program USM. If you have further inquiries, you may reach us at training@seameosen.edu.my. On behalf of the event committee, SEAMEO SEN, Audiology Program of School Health Science, University Science Malaysia, as well as Audiology Clinic Hospital Pakar USM, I would like to again express our sincere thanks to everyone for tuning in to our live event. We would also like to apologize for any issues that might have popped up throughout our webinar today. Our highest appreciation to all of our esteemed speakers for your sharing and participation. And not to forget, we would like to express our sincere thanks to our sign language interpreter, Madam Tan Li Bi, to be with us today. Finally, we would like to thank our platinum partner and gold partner for sponsoring today's webinar. Until we meet again in our next event, my name is Fitri, signing off.
It's time to open our eyes to a bright and promising future. We'll rise to the call of the times and create a stronger tomorrow. Let's start to make a difference, teaching everyone to learn through science, health, and technology. We will share our expertise by promoting knowledge and policies. We can build a better world. Let us take a step for our visions of hope, making future blessed for the people to grow in a life filled with happiness and grace. The future is our legacy. We'll achieve our goals through partnership, creating opportunities. By working hand in hand, we can accomplish all our dreams. For a better quality of life is now within